All right, let's read some examples. Well, actually, what benefits can come from climate services for health. Of course, that also tells you what else needs to happen to improve them. So these are some examples. In Kenya, humanitarian organizations are better able to quantify the risk of anticipated drought thanks to improved forecasting, increased drought monitoring, and the sharing of information. A 2022 survey by Kenya Red Cross indicated that all of the rehabilitated water facilities remained functional throughout the drought period despite the increased dependence on them as a source of clean and cheaper water for household use, while drought impacts started peaking. So that's a good example of translating information into action. In Europe, a mobile app has been developed to provide information on risks of heat waves in urban environments. In 2022, 1,000 Athenians and visitors used the app to cope with heat and air pollution. Actual lives may have been solved. So this is presented in case studies, as you can see here. Meanwhile, real-time observations of air allergens are revolutionizing the information available to users of the app and improving the health of millions of European allergy patients. Enhanced integrated risk monitoring and climate-informed early warning systems have helped people in Fiji to better prepare and respond to climatic changes, reducing morbidity and mortality from climate-sensitive diseases. 2006 heat wave in France resulted in 2,065 excess deaths, which is significantly lower than it was expected. Why? Because approximately 44,000 fewer deaths resulted from increased awareness, preventive measures, and presence of a warning system. So what kind of information is needed then? Climate information opportunities. Climate information has the potential to inform a wide range of health decisions through an improved understanding of the following: mechanisms of disease transmission, to help identify new opportunities for intervention; spatial risk, to help identify populations at risk for better targeting interventions; seasonal risk, to inform the timing of routine interventions. These are very critical because resources, and they are limited, and they have to be very precisely deployed so that you are not wasting and you are being effective and efficient. Subseasonal and year-to-year change in risk, to identify when changes in epidemic risk are likely to occur so as to initiate appropriate prevention and response strategies. Trends in risk, to identify long-term drivers of disease occurrence, including shifts in the climate, to plan for and support future prevention and response strategies. You don't want to be always in the mode of managing crisis as health outbreaks happen, but you want to build resilience in the system. So future strategies are very critical to continuously build resilience so that you are not only prepared, but you are preventing a lot of the bad effects ahead of time. An assessment of the impacts of interventions, to remove the role of climate if it interferes with the proper assessment of interventions, right? You don't want flood when you are dealing with something else. So these are compound events which are all interlinked. This is why we need a systems approach, right? So here is a nice infographic again: principles of good practice for successful climate informed health decision making. The information needs tend to be very critical, so these are easy enough to put down, but you have to be aware of what the barriers and limitations and financial needs and so on are. To quickly read off: ensure climate services are demand driven and fit for purpose. Okay, so context specific, location specific risks and climate variables and so on. Take account of partner capacities and expectations. Co-produce integrated products and services. So you have to have stakeholders, decision makers, health workers, non-governmental agencies and so on, extension agents for example. Harness transdisciplinary approaches and information. Ensure services are science and evidence driven. exemplify value-based practices, and communicate effectively across sectors, because often terminologies are different, languages are different, and interpretations can be dangerously different. So those have to be smoothed out as information is flowing across multiple decision makers in the decision system. And we'll come back and look at current status of climate services for health. Obviously, there's a huge potential for enhancing the benefits of climate science and climate services for people's health and well-being. What does this mean? The best example is always to think of, let's say, a city which is maybe not even very big but densely populated, gets hit with a heat wave. How does it affect different neighborhoods? It depends really on the socio-economic classes, housing, availability of facilities, and disaster management, early warnings, and their interpretation. Are people even aware of how to receive and use the early warnings, right? Those are vulnerabilities, socio-economic vulnerabilities. So just producing a climate service and information from the climate side is not enough. You have to co-produce the early warnings and so on, so that people can actually understand them, use them. And there is evidence from India, for example, that the impact of natural hazards has actually increased, but some of the socio-economic vulnerabilities have not increased, and some of the factors contributing, of course, are increased income levels. But educating women, it turns out that one of the critical factors, because, and it's not like giving them a college degree, it's sometimes just 5th grade, 6th grade, 7th grade education, which makes them aware of how to use a cell phone and look at the warning that comes in from the India Meteorology Department and know what decision to take. For example, if you are living in a hutment or a slum, you may have grains and other food items on the floor, and even a little bit of water coming into the hut can make food get spoiled, so they have to protect it. So simple things like this, or not to send kids outside when a flood is coming or a heat wave is coming. So all these things are life-saving decisions, but they have to be trained. This is the last mile problem. Your information may be very skillful, very reliable, and even very local, but to actually make it useful for people on the ground who are going to be affected, you have to know exactly how to translate that information from climate language into people's language and so on. Okay, so we'll come back and discuss a bit more.